What's up, people? We got another video for you guys. One of the most common problems we see in our clinic is recurrent earwax buildup, and they come in, they need to get their ears cleaned. So we wanted to make a video about how to prevent this, some common risk factors, how you can kind of prevent this at home with some conservative methods. So, if you're having pain or hearing issues anyway, you should be going to the doctor just to get it checked out, because there are things like infection that we absolutely have to rule out, and you may need antibiotics. But so jumping into a few risk factors, being in Austin, just how bad allergies can be over here, that alone can be a risk factor. Two other risk factors can be recurrent swimmer's ear. I don't recommend you swim in the lake around here, very nasty water, as well as eczema. Eczema being one of those kind of not preventable, especially in terms of the earwax accumulation, but those are significant risk factors for recurrent earwax buildup.
Yeah, a couple other common risk factors that we see pretty regularly is one in older adults. One, there just might be increased buildup, but especially in those who are wearing hearing aids. Hearing aids tend to start to block off the natural path of the earwax coming out, and so we see that pretty often. Also, because more people are using in-ear headphones or earbuds, we're seeing a lot of that even in younger people, teenagers I've had come in who've never had this issue before, and now they're having this buildup. So those are some of the most common reasons people have this problem.
Yeah.
There's also some genetic issues and disorders and illnesses that are just going to predispose somebody to having these earwax issues, and they tend to need to go into the ear, nose, and throat doctor to get them cleaned out regularly, and those people kind of know who they are.
Yeah. So ultimately, you may find yourself in the clinic, say we rule out infection. You guys may or may not know the next step is we got to remove the earwax. Typically, it's done by irrigation. We got to use some sort of softener, typically like Colace, just as an example, to kind of loosen up the wax, and then do that procedure. It may feel a little funny, a little uncomfortable, make you a little dizzy, but eventually the earwax will come out.
And that typically is irrigating with some room temperature water. People have different instruments in different clinics that can do that. And in rare occasions, we'll sometimes have to use an instrument, a little tool to kind of get that out, which again should always be done by a doctor. Mm-hmm. And there are times when we have to send even out of our clinics to the ear, nose, and throat, who they have special equipment and vacuum equipment that they use for the more severe cases.
It's typically not found in primary care or urgent care clinics. So some ways you can prevent it. I typically tell my patients use the cotton ball and mineral oil method. This involves utilizing a cotton ball, soaking it in mineral oil for about 10 to 15 minutes, up to 3 to 4 times a month. What that does is it lubricates the ear canal, and it essentially allows for spontaneous drainage of that earwax before it hardens and accumulates in the ear canal. Hopefully that decreases the number of times you need to go to a physician to get it cleaned out.
Yeah, essentially your goal is to keep the earwax soft and from drying out, which is how that's helpful. Sometimes I'll recommend patients even, put a little bit of mineral oil, olive oil. You can use the debrox drops that you can get over the counter. Those things you can put either on the cotton ball or directly into your ear, cover it up. Like I say, you can wait 20 minutes. You can sleep with it overnight. And then when you're in the shower, just gently wash it out with your regular, while you're taking a shower, let warm water run it in and out of your ear. And then again, the main things to help prevent are not putting things in your ear, or at least limiting how much. Obviously, if you're wearing a hearing aid, that's something that you need, but making sure that...
No Q-tips.
No Q-tips.
Yep.
Yeah, Q-tips are not your friend. I know they feel good, and I'm not going to say I never give in.
Yeah.
But you want to avoid that as much as possible. It's really just pushing things back and getting things stuck. But yeah, if you're wearing hearing aids, try not to wear them at nighttime. Give your ears time to push the wax out and use these methods to soften up the wax. You can sometimes, if needed, use some gentle irrigation at home with a bulb syringe or a regular syringe. We just don't want to put a lot of pressure. And again, if there's any risk of there being an infection or a perforation where you actually can get a hole in your eardrum, go to the doctor. If you're having pain, those things need to be looked at. But these are some ways that people can start to decrease their trips to the doctor and decrease the amount of earwax buildup.
Hope that was helpful. See you in the next one.